Hello and welcome to Sheila Lives Out Loud. My name is Sheila Moniga. I'm very grateful you found this channel. Please click subscribe and hit notifications so that you never miss an episode. And we upload every Monday. We do like to hear from you as well concerning the content that we do upload. So kindly make a comment in the comment section below and be sure to share this conversation as we touch base with Dr. Simon Kigondu, the Secretary General of the Kenyan Medical Association, on what's next for Kenya, even as our COVID-19 positive cases number continues to rise. Hey, Doctor, how are you?
I'm good, Sheila. How are you?
I'm excellent. I see I found you at work today.
Once in a while, we do some work.
Clearly, mko na kazi kubwa kweli as medics in the country, and I'm just very grateful for the time that you've made just to speak with us a little bit as we assess what happens next for all of us as a nation. Now, let's jump straight into what's happening. Why are the numbers rising like this? Are we testing more?
Thank you, Sheila. The rise in COVID cases was expected. As you realized initially, when COVID was detected, we took mitigation measures such as closing our borders, closing our airports, and the people were kept at home for quite some time. And their biggest issue was when will they open up the country, and indeed the country was opened up with the only mitigating measure being the curfew between 11 and 5 a.m. And with that, COVID went to the counties. So initially there were hotspots of Nairobi, Mombasa, and the border towns. But now that the economy was opened up, so to speak, then we are seeing the numbers are rising, and the contribution is literally from everywhere. So the number rising means that now we have what is called widespread community transmission. So the rise in numbers is expected.
Okay. In speaking about the rising numbers being expected, are our healthcare facilities, not just in Nairobi, but across Kenya, we had a head start. We had about 6 to almost 8 months to get ready for this time and place. Are our healthcare facilities ready?
That's a very important question. And as I alluded to earlier, the reason why lockdowns were done was to have every sector prepare themselves for an eventuality of COVID cases. Now, a big chunk of what was needed to be done was an improvement of the healthcare system, so to speak. And several recommendations were made, like, for instance, counties were asked to get 300-bed COVID facilities, increase the number of people they have employed. And it's obvious that that did not really happen. So to build a picture is that to have a functional unit that is ready to receive COVID, then you would have the necessary infrastructure, the building in place, the machines in place, and the necessary human resources for health. So you have the doctors there, the trained nurses, and the other health workers who are needed to run a health system. So this necessarily did not happen. And as a result of that, we are seeing that currently, as the number of COVID cases are rising, then we are using the same infrastructure that we had before. So you will find a county, when it gets a critically ill patient who requires ICU care, they are still referring to KUTRH, Kenyatta University Teaching and Referral Hospital. That means that they did not prepare to receive critical patients. Now, we are also having services closing down. For instance, when you have a hospital where the health workers who are working in that unit, for instance, contract COVID, the management of that is that they need to go to isolation and their contacts need to go for quarantine. You find that when that happens, then the health system is left without anyone. Why? Because more people were not hired in preparation of that. And also, we have recommendations where people should work in shifts so that when one shift gets COVID, then the next shift can continue. And we see that that may not have happened. So, as I said, COVID is a situation which helps us build back better. Build back better means that the measures we take now will help improve healthcare service delivery in future. For instance, employing additional doctors, for instance, is not only for COVID. After COVID, they'll still be used to perform the health services. Building an ICU and equipping it and making it functional is not only useful for COVID, but it will also be useful for other health cases that require ICU care, and there are many. And therefore, the call is to actually improve the health system, because it will not only be useful for COVID, but it will also be useful to take care of Kenyans after COVID.
Now, over the past few weeks, we've seen internal memos from several hospitals indicating that there has been a spike in admissions or in the number of patients coming into the hospitals who are testing positive and who are exhibiting symptoms. Going forward, for all of us in whatever county we find ourselves in, what happens next? Because there is no doubt about it, a sense of panic has begun to set in. So, what is the way forward for all of us?
So, as the situation is currently, getting COVID is not a matter of if, it's a matter of when. The reason for this is that there is widespread community transmission. There are mitigating measures that you have been asked to do by the Ministry of Health, such as washing hands, keeping social distance, wearing masks. But these a lot of Kenyans are doing, and maybe many are not doing. But our biggest concern is on the political gatherings. And it may not be said, but political gatherings are actually driving the numbers of COVID. And we have seen, and you will see that doctors cringe when they watch news and see political gatherings and see people interacting without taking the measures that they have actually been told to do. And it is a big political responsibility for the politicians who are organizing such meetings to actually show by example what needs to be done as COVID to mitigate COVID. We understand the pressure of politicians. They need people, a lot of people shouting and feedback by seeing crowds. But I think when this is not right amidst a pandemic. So a good example would be the what was trending yesterday, that Professor Magoha was finally seen dancing and then when you look at the video, you see he has not moved anywhere. He's wearing his mask and he looks very angry. And I can only imagine what was going through his head. He's saying, these politicians, what are they doing? Why are these people, you see? And for him, the weight is even greater, because such behavior would make his work difficult. As the Minister of Education, he's trying to operationalize schools, but we are exhibiting behavior that is likely to make school difficult, because the political gatherings look like they will increase the number of COVID cases. And it's only fair then that politicians should actually lead by example. And if I was a president, I would ban political gatherings.
Right. Okay. That is true. We have seen many gatherings over the past couple of weeks as well. And I do believe the president did make a directive and say we all have to take personal responsibility for our actions and for our choices. Na pia akasema mwende mkunywe pombe. I'd like us to revisit the education ministry in just a moment. Right now, let's focus on pombe and the entertainment sector, which has really been hit hard this year. And a lot of people are now saying, I think the best thing to do is to close the bars and enforce that curfew again. But locking up this economy, surely, how practical is that at this point?
Yeah. So there are various stages of a pandemic. There is the initial stage where there are a few cases where you try to restrict entry of the virus, so to speak, and measures like lockdown and are done. The second stage moves when you have a few cases that have come in and you're trying to do the same thing, but also try to detect the ones that have slipped through to the community and detect them, isolate them so that they don't spread to the community. Then you get limited community spread. And then on the fourth stage, then you have widespread community spread of the virus. By the time it reaches widespread community spread, which it has for Kenya, then the measure called a lockdown is not useful. It would be employed only in a place where if you have a very high case burden, but the lockdown was meant for two things. One, to try to limit the entry of the virus into the community, and two, to put in place measures such that when the virus becomes widespread, then we are able to mitigate the effects of the virus. So where we have reached is that it is in the community. Now, where politicians are the ones who have the burden of balancing between opening the economy and preventing disease. So the Ministry of Health has actually done quite well. All the measures it has put in place were actually very good. And you saw that actually the COVID was actually controlled for some time. It's only now when people now start having difficulties earning money, children are not going to school, and therefore it's becoming an advance. So it's a balancing act. But now the balancing act should, we should do what we can do. For instance, if you're asked to wear a mask, you wear a mask so that even as we are trying to prevent, to rebuild the economy, so to speak, then people are doing what they're doing. The biggest issue is doing what you're not supposed to be doing and yet saying, oh, the economy needs to open up. So for schools, my personal take is that schools need to continue, but with measures. And we need to be aware of the fact that schools will actually lead to an increase in COVID cases. So by not opening schools does not mean that you have helped the situation because you're balancing between the education of the children and schools. Schools definitely will have, but measures must be put in place in all schools such that if you get COVID, what do you do? And I think we have a program of training schools on what to do in the COVID season. You need like a checklist of the things that should be in place for schools to be there. You need a checklist saying, do all the children have masks? Do all the children, is the school having running water? Are the teachers trained on COVID, so to speak? And is all these measures taken? Is there some form of physical distancing? Have they looked at the sports to see which sports might not be able to transmit? Have they identified who their vulnerable teachers and students are so that they can protect them more? So it's some form of checklist that needs to be done because COVID will be here with us for a long time. I can predict a minimum of 2 years, minimum. And therefore, we must work as if it is there, but we must also work to mitigate its transmission. And if one should get COVID, we should act to mitigate its effects on the school system. So that's my take. I think schools need to continue, but everyone needs to do their part in ensuring that they have placed measures to prevent transmission of COVID. And if you get COVID, then you can be able to manage it.
Okay. Now, what you have said to me is still ringing in my head. You said it's not a question of if you get into contact with COVID, it's a question of when. It's here for a long time, and everybody's going to get their turn in the ring.
Yes.
Technically, from what I've understood from that statement right there, we are in the widespread community spread stage. So, effecting another lockdown, really, the horse is already out of the stable. There's no stopping it from going where it is going to go. So, how do we manage? I think right now what I'm asking is symptoms, management, and precautions, just to echo the message that you've been sharing with us all through this year.
Yes, so COVID is known to start initially as a respiratory illness. So the symptoms you might get are those symptoms of a flu, maybe a running nose a bit, and throat irritation, and that can lead to a cough and sort of a dry cough, and and then it can then lead to some people, if it goes downwards towards the lungs, then you can have a bit of difficulties in breathing, and these are sort of some of the early signs. And people who may have had contact with people who maybe had similar symptoms or have been tested to be COVID positive, and they start getting such symptoms, then they would be advised to do a test and maybe do some self-isolation. And the respiratory systems at this particular time are highly suspicious of COVID. But testing has now been sort of prioritized to those with symptoms and also to the health workers. Actually, the health worker fraternity is a special breed because they are coming in contact with all these people who are coming complaining of cough. And even when they're not complaining, they're coming from a community where COVID is widespread. So their interaction with the health workers may lead to getting COVID. And therefore, the health workers are advised to actually maintain personal protective equipment. They wear their masks, preferably N95 when they are at their places of work. And so that because they are the most sort of vulnerable and more likely to get COVID, even as it is in the community. And as a result of that, anyone who feels unwell, fever, may request for some form of assessment and see what happens after that.
Okay. Going forward, pay attention to the basics that we've been hearing on the news. We've been reading about it in all the papers, in our social media as well. Wash your hands, sanitize. Anything new that's come up that we should pay attention to as well?
Actually, the basic, if we all adhere to the basics, like wearing masks, especially for me, I think wearing masks is one of the most important aspect of these. And this is just to prevent transmission from one person to the other, to and fro. Masks have shown to actually reduce transmission. So if everyone is on them, then that will help mitigate. Again, washing hands with soap and water, as we have said, the transmission of touching, then bringing your hand to the mouth is what leads to transmission and breathing. And more important now is that maybe we all need to urge the government to actually improve the health system. And as we have said, the components of the health systems are many, but the most important one is the human resources for health. They need to increase the number of people who are available to treat Kenyans. We think that an increase in the number of health workers employed will help mitigate the pandemic. We also want them to increase their capacity. Like, for instance, we had said again, ICUs may be necessary. We need these built, and if they are built, then they are able to manage people who require respiratory support. Again, another important point is oxygen points. It had been shown that if people are given high flow oxygen, especially when they reach a critical state, then many of them may not require ICU. But if you don't have points where oxygen is available, which needs to be put in place, then you take more people to ICU and this becomes overcrowded, and then you start having to choose who do you put in ICU and who do you not put in ICU. A very difficult decision for the doctors. So I think we all need to play our part, and on the part of the media and for Sheila Lives Out Loud is to inform the public on all these things. I think the media have a very important role to play, and correct messaging and giving out information. And I think you're doing a good job, Sheila. Keep it up.
Thank you. Thank you very much, Doctor. Couldn't do this without you and you making time as well. And together with, of course, the other medical practitioners I've spoken with across the year concerning COVID, I'm very grateful and we wish you all the very best. Sasa ni kupambana na hali yetu. To do our best.
If, not if, when.
Oh my goodness, that's still in my head. It's not a question of if, it's a question of when. And are you going to be prepared when that when shows up? Thank you so much, Daktari. I wish you a wonderful week ahead. It's always a pleasure touching base with you. I wish you safety, I wish you sanity, and I wish you health. Please take care of yourself. Take care of those around you. We are all officially soldiers in the war. It's not about hiding in our houses anymore. It's a question of not if, but when. And we can all make it through together if we follow the guidelines and the instructions that are shared to us through our health ministry and our health officials. Thank you so much for catching up with me on this episode. Drop us a comment in the comment section below and please share this video. It's got crucial, vital information that could go towards saving a life. I'm grateful for your company on this channel and look forward to you catching up with me again next week. Until then, live out loud in all that you do. Bye for now.